Yeah, sure. So yesterday, this talk was about the different comparison about unrelated donor transplantation versus haplo donor, and this is in the context of the SFGM-TC, the French Society of Bone Marrow Transplant and Cellular Therapy. And what I would like to show there is how in our society and in the EBMT we give some data to support the fact that haplo transplantation should be considered now as a similar donor as unrelated donor transplantation. So this is supported by many large studies from different groups, namely CIBMTR or EBMT, with a lot of 100 patients with similar survival between haplo and unrelated donor transplantation. And now I think this is important because it opens perspective for the physician to have the choice of different donor between haplo and unrelated donor based on different donor characteristics. And today I think we can play with these new parameters, for example donor age or donor sex mismatch, to choose if it's better to get an unrelated donor or a haplo. So I think this is important because today I think most of patients can have a donor, and it's very rare that we have that we cannot proceed to transplantation because of an absence of donor today. So the first message here was to say that if there is no HLA match sibling donor today, we can find either an unrelated or a haplo donor, and that's good for the patient. And the second point of the talk was about how we can adapt or optimize our transplantation modalities to the best donor selected for special patients. And I think we don't have the best donor for every patient, but for each situation, specific situation of patient, disease and timing, we have the donor for which we have to adapt conditioning regimen, GvHD prophylaxis, and I think here there is a big challenge for the next years.